manager of Camp Oasis for the Crohn's and Colitis Foundation. As a Crohn's disease and ostomy patient myself, I'm thrilled and honored to join you today to celebrate World Ostomy Day. Approximately 1 in 500 Americans live with an ostomy, a surgically created opening in the body for the discharge of bodily waste. Whether it's because of IBD, cancer, diverticulitis, or incontinence, an ostomy can give people with life-altering illnesses a new lease on life, one with fewer hospitalizations and complications and less debilitating pain. In fact, many patients with ostomies report a new freedom and feeling of good health after having ostomy surgery and have accomplished things they never thought were possible. Unfortunately, ostomy surgery remains very misunderstood in the public eye. That's why we participate in World Ostomy Day and work to raise awareness of these life-saving appliances year-round. I'd like to thank today's sponsor, Hollister. Their support enables the Crohn's and Colitis Foundation and our partners to continue to provide important education for patients and caregivers. Today, we are happy to be joined by a terrific panel of experts. We have with us Dr. Mukta Krane. Dr. Krane is an associate professor of surgery and the section chief of colorectal surgery in the Department of Surgery at the University of Washington in Seattle. Dr. Krane specializes in robotic, minimally invasive surgery, colorectal cancer, and IBD. She's also a member of the Crohn's and Colitis Foundation's National Scientific Advisory Committee. We also have with us Linda Coulter, a certified wound, ostomy, and continence nurse since 2010. She currently cares for patients at University Hospital's Ahuja Medical Center in Beechwood, Ohio. Ms. Coulter is a current member of the Board of Trustees for the Midwest region of the Wound, Ostomy, and Continence Nurses Society, as well as a member of the United Ostomy Associations of America's Medical Advisory Board. And finally, we're excited to have with us Joel Nixon. Joel is a Crohn's disease patient who was diagnosed in 2007 and had an emergency ileostomy in 2016. He's a personal fitness trainer and a tireless advocate for the IBD and ostomy community who enjoys documenting his lifestyle and inspiring others along the way. Welcome, everyone. We're excited to have you.
It's great to be here. Thanks, McKenna.
Awesome. So for the next 30 minutes or so, we're going to talk about all things related to having an ostomy and IBD. We want this to be interactive, so please comment on this video, tell us who you are, where you're joining from, and if you have an ostomy, and of course, don't forget to ask questions. Please remember that the information provided during today's chat is meant for educational purposes only. The views shared during today's chat do not represent the official position of the Foundation or the UOAA. IBD is experienced differently by every patient, so always consult with a physician when making changes to your IBD treatment regimen. If you have a question about IBD unrelated to ostomies, we won't be able to get to that today. However, we encourage you to contact our IBD Help Center to get your questions answered by emailing info@crohnscolitisfoundation.org or calling 188-MY-GUT-PAIN. With those disclaimers out of the way, let's get started. So Dr. Krane, I'd love to start with you. For those who may be unfamiliar with it, what exactly is an ostomy and what are the different types of ostomies that patients can have?
Yeah, so I think that's a great place to start. As you said, I think ostomy surgery and surgery for IBD as a whole is often misunderstood. And so I think this is a great forum and I'm really happy to participate. Ostomies are essentially when we bring a piece of the intestine, usually the small intestine or the large intestine, out from the abdominal cavity through the skin. We open it, we attach an appliance, some people call it a bag, but there's an appliance that attaches to the skin and adheres to the skin and allows for waste, either urinary or fecal material or small intestinal material to come out into the bag. We do it for several reasons, and there are actually a lot of different types of ostomies. I think the most common that people think of are ileostomies and colostomies, and then in the urology world, urostomies. For most of our IBD patients, it's ileostomies or colostomies, and an ileostomy just means that it's a piece of small intestine that we've brought out. A colostomy means that it's a piece of colon that we've brought out.
Thanks for that super clear explanation. Hit it right on the head. Can you tell us a little bit about why an IBD patient, what are some of the reasons a patient might need to get an ostomy?
Yeah, so ostomies can be either permanent or temporary. Usually, when we operate on a patient with IBD, we're doing it because they have a significant amount of inflammation, and it's not often treatable or totally controllable by medical management. Or we're doing it in an emergency setting. So if someone develops a blockage or they have a hole that develops in the intestine, and we're doing these operations in less than perfect circumstances. So in times when it's temporary, it's usually because we remove a piece of the intestine and we either at that time make a connection or feel like at some point we will be able to reconnect the GI tract. So, we make a pouch for patients with ulcerative colitis, or we remove a section of the colon in an emergency, but still have enough colon that's healthy to reattach. In that circumstance, we'll make a temporary ostomy just to give the body a rest, or our connection, if we've made one, a rest, and let the patient come off of steroids, high dose medications that they're on, improve their nutrition, so that we can go back and do another surgery where we can restore GI continuity, put things back together, but in a healthier state. Other times we can't do that, so we have to remove, often it's when we have to remove the entire colon or rectum. Or because the patient is experiencing other symptoms, including incontinence, which you discussed, where even if we were to reattach the GI tract back together, the quality of life would be incredibly poor. And in those circumstances, we bring up a piece of intestine, again, usually small intestine or colon, to just allow for bodily waste to exit the body, since we no longer have the GI route. And that usually, as I think you'll hear about, can really afford people a significant improvement in their quality of life.
Thanks for that great explanation. I'd love to go on to Joel to talk about kind of the patient perspective. So you were diagnosed in 2007 and you had your surgery in 2016. What were some of the challenges that you faced before you had surgery?
Well, when I first got it, I was in high school. So a lot of it was, I had fatigue and stomach pain. That was the main symptoms I had. So even getting up for school would be really hard, or staying up in class, paying attention would be really hard, just sitting there and having the pain. And at the time, I didn't tell anyone either about my Crohn's disease. So they kind of just looked at me like pretty much like the kid doesn't want to learn, or the lazy kid. So that's one perspective. Also just actually being social. Friends, they would want me to come out, and there'd be days I was like, yeah, that's fine. I would go home, would sit in bed, and I would just pass out. I'd wake up, be 10 o'clock at night. Or dating, it was really hard. It's kind of like living a double life, having to go if I have to go to the bathroom frequently. If we're going somewhere, I have to make sure it actually has a bathroom. I'm able to get there, maybe bring a extra pair of clothes. So a lot of those things, it was really, really hard back in the day, pretty much coping, trying to do the young thing, but still trying to figure this Crohn's out, having Crohn's disease. And at the time, it was myself, I kind of just ignored it. When I first was diagnosed, it was so shocking. I honestly didn't know how to feel. I just kind of ignored it. I said, okay, I have Crohn's disease. They gave me the medicine to take, and I was just like, kind of act like it wasn't even there, which was a very bad idea. But yeah, that were a lot of the things that I had to deal with. Pretty much very severe stomach cramping and frequent bathroom use.
Yeah, Joel, I think so many patients can identify with what you just described, especially young patients, kind of that feeling of almost leading that double life. I think that is such a good description of how many of us patients feel when we're kind of in the depths of our disease. So how did you end up coming to the decision to get ostomy surgery? Was it even a decision? I know that you had it in kind of an emergency basis. So talk a little bit about that.
Yeah, so it was a decision, but it was kind of an emergency. So in 2016, it was pretty much when my quality of life was at its lowest. I would have to go to the bathroom just frequently everywhere. I was working 2 jobs at a time. And so I still also didn't tell anyone about my Crohn's disease. So it was kind of pretty much just letting my health just go, you know, go to the gutter. And it one day I just felt so horrible. I went to the gym actually, and I tried to do like a push up or something like that. I couldn't even do that. And I was like, "It's something wrong with me." So I went to the hospital, and they said that I had strictures, I had a high fever, I had excuse my language, I had an infection in my butt. So what they wanted to do was give me cetons and also give me an ileostomy to divert the stool from that area to my stomach to give it a rest. So they told me it was my decision, but it was an emergency. So at the time, I was just really scared. I Googled some stuff, and I didn't see much at the time. But at the time, I felt so horrible. I was willing to try it. Anything would be better than this. So.
Thanks, Joel. I really appreciate you telling your story. And again, I think a lot of patients can identify with that, in that it's a scary decision. You have no idea really what to expect, but at the time, you're so sick that you're kind of willing to do whatever it's going to take to get your quality of life back. So thanks for sharing that, Joel. So next question is for everybody. What is the best way that patients can prepare mentally and physically prior to ostomy surgery? And I'd love to start off with Linda. As a wound ostomy care nurse, what do you feel is the best way patients can prepare ahead of their surgery?
So there are a lot of really good resources that are reputable resources to look at. Connecting with somebody like Joel is a great way to know somebody else who's gone through it. If you don't know how to reach somebody, go to the United Ostomy Association's website, and they have links to local support groups. And in those groups, you can find people that have gone through or are going through what you're going through. It's a really good way to just connect with other people and know that you're not alone. And also on the Ostomy Association's website, they have a lot of great information that really makes it easier to understand what you might be going through and why you might need surgery and things. So it's just a really great resource for doing that. But look for the reputable resources. Sometimes you can hear about real horror stories, and things are out there that are horror stories, but there are so many great stories, and those people aren't online sharing those great stories because they are out there living their lives. Not all of them are sharing their great story like Joel is. So look for those positive things.
Yeah, Linda, that's really great advice. Thank you. Dr. Krane, what do you feel is the best way that patients can prepare ahead of their ostomy surgery?
Yeah, so I think it's Linda and Joel. So I think having a meeting with a wound ostomy nurse and doing it really early in the path. I feel like, sort of in Joel's experience, you're often left having to make these decisions at the last minute. And it's really stressful to not have those resources and to have to look online and figure out, what is going to be the best for you and the best for quality of life. I see a lot of patients way before they make the decision to have a surgery that's going to require an ostomy. And the first thing I do is say, I'm going to set you up with our enteral stoma nurse. I want you to bring a list of the things that are really important to you, things that you want to keep being able to do, things that you've compromised doing. I live in the Pacific Northwest, so a big thing is mountain climbing, which I'd never thought of when I lived in the Midwest. So I have patients that bring their packs when they go to meet the enteral stoma nurse and say, where would I put a stoma? How would it work? I'm going to be out in the wilderness for 3 days. So what does that look like? And I think it really alleviates a lot of people's concerns and fears. And then I would say seek out patients. And I cannot tell you, Joel, how much I appreciate that you're doing this. I'm often the first person to talk to somebody about a stoma, and I feel like the patient experience is invaluable. I had two patients yesterday that I saw, one who has a new stoma, and he shared a story that happens a lot when I see patients, which is that he went to a restaurant for the first time after his surgery and immediately did what he does every time he goes out, which was scan the room to find where the bathroom was. He was sort of panicked because he couldn't find it. And then he was like, oh, I don't have to. Like, I can sit here and have this entire meal and I don't need to know where the bathroom is and I'm not going to have to run there. And it's not something that if you don't live that experience, you realize that people are going through and that can have an impact on quality of life. So I would say everybody understands that it's a really scary process. Figure out what is important to you and what you're worried about. And I think what you find is a lot of patients will say, I wish I had known this, and this before I had the surgery, or I wish I had known these things in my decision. And I think as a medical community, we have to do a much better job of starting that process early, of saying, you may not go on to surgery, you may not need an ostomy, but the fear of an ostomy should not be what makes the decision from you tolerating a really poor quality of life when you can get your life back.
I wanted to jump onto what Dr. Krane was saying. It's so true. And we do have, the surgeon I work with often will have me meet with people a few months before while the person is making their decision so that they can learn about it, because it can be so scary. And for who knows how long they've been saying, no way, no way. And then I can ease them into learning about it, give them some additional resources so that when they get home and their head's not exploding from the possibility of going into surgery, they can look some things up and hear some real people's stories that have really gotten their life back. That I think that's key. And it's so hard to tell people that you're not going to have to scan the restaurant for the restroom. You're going to be able to go out and be with your family and go to the birthday party. And they don't even realize how poorly they're feeling. And then after surgery, they do come back and they say, I wish I had done this sooner. And this did give me my life back. So it can really make such a positive difference.
Yeah. Joel, did you have anything you wanted to add? What was helpful for you in just preparing for your surgery?
Yeah, well, those two, they said basically everything. The IBD community, Crohn's colitis community, or ostomates, a lot of them are willing to help you or talk to you about getting an ostomy and their experience. So that always helps. I know for me, the one thing that actually helped me too, it was funny. My nurse that was treating me at the time, before I got my ostomy, she actually had an ileostomy too. So she told me about it. And she was like, and here I am. I'm still working. I'm still able to do what I want to do. And she showed me tips too of like how to empty it and stuff like that. So it made me a lot more happy, and I would say reassured myself that everything was going to be okay after the surgery. And another thing, just for me, I'm not sure if this is an actual thing, but I feel that eating healthy or making sure you gain a little bit of weight before you actually have surgery would help your recovery a lot faster and prevent you from getting like infections or anything like that. So I know that's a thing that would help.
Yeah, awesome.
Yeah.
Thanks to you all for that. Yeah, Linda, did you have something you wanted to add?
I just wanted to add regarding the nutrition. We will have people that are having planned surgeries improve their nutrition by taking like protein drinks. They have a certain one that they'll give people. So check with your physician about that. Just because like what Joel said, the stronger you are going into the surgery, the more nutritionally healthy you are, the better you're going to be able to heal, the quicker your body will be able to heal. So it's one of the steps they're implementing now at our location to help people recover more quickly.
Thanks. I think there's so much good information that all of you just shared that I hope will help somebody who's watching right now as they're kind of preparing for their surgery. Linda, I know we talked a little bit about the role of a wound ostomy incontinence nurse, but I would love for you just to talk about kind of what you do and what support is available for patients as they recover from surgery.
Sure. As an ostomy nurse, I start working with people in the preoperative time. I do start doing education on what to expect. With having a stoma, I start with just describing what the GI tract is, and then going to what a stoma looks like, what it will potentially feel like, that it doesn't have pain receptors, so it's actually not painful. I show them what a pouch is like, what Joel talked about, having that nurse that had the stoma is useful. I don't have a stoma, so I do show them different samples and go through a few different product options and explain that it's kind of like shoes. Not everybody wears the same type of shoes, and not every shoe fits everybody. So you need to be fit into the best pouch for you, or the best bag for you. Then after the surgery happens, I go in and start working with the patient on how to take care of the stoma. Now, technically, that's not a very difficult thing to do. We teach children to do that, but it can be scary and kind of dizzying to just look down and see this new red tissue on your belly that you haven't had for all your life. So it's more getting used to having the stoma. So I walk them through very slowly. Each person is a different, takes a different amount of time. And I say, you need to take the time that it takes you to get used to having the stoma, but you're going to be able to take care of this. And so many people have come back and said, I know that first day I told you I wasn't going to be able to do this, but I'm doing it and it's no problem at all. So after I work with people in the hospital, I'll send them home with some supplies, instruction sheets, my phone number. I recommend that they get a home healthcare ostomy nurse. And I ask them to look for a home healthcare agency that has a certified ostomy nurse, because not every home care agency has that. And people just do better just by the agency having a certified ostomy nurse on staff, even if they can't go out to every visit. That nurse is who sets the person up with getting supplies sent to their home and things. But that I'm always there for the people too. They've got my number and know how to reach me in case they're having issues. And then we keep working with them. Like I keep working with people down the line, like for their annual checkups and things like that, to make sure things are still going right for them. So that's kind of in a nutshell what an ostomy nurse does.
Thanks, Linda. Yeah, really good explanation. And I know that for me, and Joel probably feels the same way, wound ostomy care nurse was just essential to have a good relationship with that person and really kind of soak in all the great information that they have. So Linda, just so appreciate what you do. Joel, I have a next question for you. How long was your recovery, and did you notice a change in your quality of life right away?
So I think my recovery took about 3 months. I didn't feel a change right away, and I think it was because I still had stool in me. So after I got the surgery done and I finally went home, I was still going to the bathroom both ways. So at the time, I was like, this ileostomy didn't even work. Like I'm still going to the bathroom, but as time went on and everything cleared out, then I noticed a big difference of not having to go to the bathroom from that area anymore. And actually, I don't have any stomach pain anymore. That was the main thing for me. The cramping used to be horrible, and now I don't have it at all.
Thanks, Joel. That's great to hear that kind of once that initial time period passed, you really noticed that quality of life difference. Were there any lifestyle changes that you had to make following your surgery?
I think only lifestyle changes. One is I carry around water a lot, just to stay hydrated. So I'm sipping water nonstop. I always take just a bag with me, just in case of a leak or anything. And I think, I'm more open. Well, I'm very open now about actually my ostomy and me having Crohn's disease and ways which it can benefit me. So if I let my uh, people that I work with know, or anything like that, if I need a day off because I'm feeling fatigued or I have to go to the hospital, the doctors for infusion or anything like that, I can let them know and it be no problem.
Thanks, Joel. So on that, kind of expanding on that, what does a typical day look like for you with your ostomy?
Sorry. So a typical day would be pretty much I wake up, I empty my bag, I take a shower, brush my teeth, I'll eat. I like to eat early because I know for me, my bag makes the most noise after I'm done eating my first meal. So after I get all that out of the way, then I'll head to work. I'll work for 8, 9 hours. And between that time, I might have to go empty my bag maybe twice, 3 times if I want to, but usually twice. After that, I'll head home, eat again, empty my bag, excuse me, go to the gym, work out, and then I'll come home, drink a shake, go take a shower, pretty much relax. And before I go to bed, I'll empty my bag one more time.
Awesome. And I don't know about everyone else out there, but that really sounds like a day in the life of a typical human being, with the exception that instead of, sitting down and doing your business, you're emptying your bag. So I think it's great for people out there to hear that your day really looks a lot like everybody else's average day. So that's great. Thanks for sharing, Joel. Linda, why do you think it's so important to self-advocate if you have an ostomy?
Even though there are about 1 million people in the United States living with stomas, and many people know people that have stomas, they just aren't aware of it. So the awareness in the general population is low, but also I have found that even most nurses and doctors don't know much about stomas or stoma care. So after you get a stoma, you're going to be the person who knows the most about your stoma. Your stoma nurse is going to know a lot too, the one who started with you, but after that, it's going to be you, and you're going to need to say, hey, even if you get admitted to the hospital, this is how I change it. This is how frequently I empty it. This is when I need to empty it. I know the first time I saw somebody when I was a new nurse, I didn't know when to empty a pouch, and the gentleman said, I think it needs to be emptied, and he wasn't able to do it on his own. And I'm like, oh, there's still room. I didn't realize you need to empty it when it's about half full. So you really need to advocate and educate, because that's not what the nurses or the doctor's specialty is. One really good thing that I picked up from the latest conference that I went to last weekend, it's from the United Ostomy Association, developed the Ostomy and Continent Diversions Patients' Bill of Rights. And it really talks about being able to advocate for yourself. And it includes all stages, from before surgery, during surgery, afterwards, and just lifelong. So it's a really good resource to look at and share with people, not just other people who have stomas, but share that with your caregivers and with your family members so that they know. Again, just the awareness is low. Yes, we're working hard to get it, people more aware and learning more about it. But you really need to take charge, because people aren't going to know like you might expect them to.
Yeah, Linda, that's such a good point. So individual, and everybody kind of has a different rhythm and routine and things like that. So that's a really good point.
Sorry, I love hearing people's tips and tricks. So if you have things that you're doing, please share it with your providers, because I just get a wealth of information from patients that then I pass along to other patients of experiences they've had, things they wish they knew the first couple of days, how they travel. And I would also say, feel free to always talk to your provider, your enteral stoma nurse, your surgeon about things that you're concerned about. We, I think, have probably heard it all. And if we haven't, we should. So things like intimacy and swimming and pregnancy, like all of these things that when people ask us questions, I'm often like, oh, let me look into that. That's a great question. And I learned so much more that hopefully I can share to other patients.
Awesome. I think that's great, Dr. Krane, that all of our healthcare providers are open to kind of hearing our tips and tricks and passing that knowledge along to the next person. So as kind of our final question, I want to put it out to everybody. What advice do you have for patients facing ostomy surgery? And Dr. Krane, why don't we start with you?
Yeah, so I would say, I mean, I'll start by highlighting, I think, what Linda said and what Joel said, which is go to resources you feel comfortable with, but go to some resources that are positive and go as early as you can. I think also remember, we are happy to answer a lot of questions. Ask as many questions as you need. And lastly, I think a lot of what Joel talked about and a lot of patients is, I always tell people, stop and think about what quality of life you're tolerating to avoid an ostomy at this point. And all of the things that you have, maybe not immediately, but over the last several years, given up, from what you can eat to what activities you can do to, you know, how much you compromise your life. Like, I bet if you asked Joel what his day was like before the ostomy, it actually, there would be a lot more compromise that he was making, or a lot of patients make, than once they have the ostomy. So I think let us try and alleviate some of the fears that you may have.
Dr. Krane, that's so true. I think so many patients kind of adjust to this new normal of their disease, and it becomes their normal. And it takes somebody else kind of challenging that and saying, is that really normal? Do you have to be living with these things? And sometimes it just takes that outside perspective to kind of go, you know what, I shouldn't have to tolerate that. So I think that's a really great piece of advice. Linda, what advice do you have for patients who are facing a potential surgery?
So yes, go to those reputable resources, not only the UOAA and CECF, but there are some of the manufacturers have some great things that you can get. Like, you can go online, they're like pre-op kits, so you can kind of get them. It gives you more information, and it can just help you prepare for your surgery and help you decide about surgery. As an ostomy nurse, it's my goal to give people that have ostomies, that are living with stomas, some peace of mind, help them develop that, and help it be the stoma and the appliance just be part of their life, but not their entire life. I can't tell you how many times people have come back to me and said, Linda, this gave me my life back. And that is just so true. And I just want that to be true for many, many more people.
Thanks so much, Linda. And last but definitely not least, Joel, as a patient to other patients out there, what advice would you share?
Pretty much a lot of what they said. Just get as much information as possible of ostomy and how it works and what's the best products for them. Having a good support group is always good. If you have family that's positive in your corner, that'll help you, make that transition. That's always good. And just keeping a positive attitude. Me personally, I'm spiritual, so I prayed on it. But if you pray, meditate, things that'll ease your mind about everything, and just know it's not the end of the world. Life is gonna go on after. You're gonna be able to continue to do things you love, and even more, because I know for me personally, it was hard to do a lot of the things I've done before I had an ostomy. And now that I had an ostomy, I've been able to do a lot more, a whole lot more. So it's not the end of the world.
Awesome. That is so inspiring, Joel. Thank you so much. And with that, that is all the time that we have for today's World Ostomy Day Facebook chat. Thank you to everybody who joined us, and I especially want to thank Dr. Krane, Ms. Coulter, and Joel for sharing their expertise and experiences with us. Thank you also to UOAA for their continued partnership, and to Hollister once again for their support of this program. The best way to raise ostomy awareness is to educate others and share accurate information and resources. You can learn more about IBD and ostomies by visiting the Crohn's and Colitis Foundation's website at www.crohnscolitisfoundation.org and the United Ostomy Associations of America's website at www.ostomy.org. Thank you and have a great weekend, everyone.